Welcome to Becoming Arketype, where we explore the science and strategy of natural health optimization and performance so that you can achieve your ideal self. I am Dr. Ryan Sousley. Okay, so let me ask you this. If our healthcare system is really designed to keep us well, then why are so many Americans on medications? You know, why per capita are more Americans sick now than ever before? I mean, if you just look at statistics, like we are not doing well as a country when it comes to health, despite all the money that we're spending, all the drugs that we're taking, all the medical advancements and the, health breakthroughs that we are supposedly seeing. More and more people are sick in America compared to any other time in our nation's history, and most people think that their doctor or the system is the thing that's going to save them. Like you might think that your doctor is going to take care of you when you get sick and he's going to protect your health. And I think doctors are good people, but the truth is that our healthcare model isn't built to make you healthy. It's built to manage disease. And there's a time and a place for that, but there's a vast difference between managing disease and building health or managing health. And so that's why waiting until you need medications or surgery is the fastest way to get stuck in pain or be dealing with side effects or create this dependency on the medical system, which so many people, by the way, I mean, if you've been there, you know what I'm talking about, but when you enter the medical system, it's very difficult and in some cases almost impossible to get out because you just end up on this merry-go-round where it's diagnosis, prescription, medication, treatment, and then wait and see. And then it's another diagnosis, prescription, medication, treatment, wait and see. And then before you know it, you're managing 4 or 5 things at once and you're not actually building health. You're just managing disease. And we do have a great system for managing disease, but I don't meet a lot of people who want to manage disease. In fact, I've been doing this for over 15 years. I've seen thousands of patients and I get to speak all over the place. And, I don't know anybody that wants to be part of the system. Everybody's looking to get out of the system. And so in today's episode, I'm going to show you the difference between sick care and true healthcare. And the good news is that true healthcare is this new and emerging thing, which actually, when we talk about it, you'll see that it's actually a revert back to the way that we've been managing our health, since the beginning of time. But I'm going to show you the difference. And I'm also going to show you the 3 biggest reasons why our healthcare system keeps people stuck and the mindset shift that you need if you want to master your health instead of just managing symptoms. So we're going to get into it. Before we do, hey, make sure you hit that subscribe button just so that you never miss an episode. It's also how we can reach more people. So you can help us spread this message just by hitting the subscribe button. And I really appreciate it. So let's get right into it. So if you didn't know, which I think most people recognize this, but our healthcare system's not doing well. The US is drowning in chronic disease. 6 out of 10 Americans, according to HHS, 6 out of 10 Americans today have at least one chronic disease. And many Americans, maybe if you're listening, this is you or someone that that's in your family. But many people are dealing with more than just one. Listen to this. I mean, 4 out of 5 people in America today die from heart disease or cancer. It's the top 1 and 2 leading causes of death. And those numbers continue to get worse every single year, despite treatments and all the fundraisers and the pink football shoes and the ribbons and all this, money that's being raised and this awareness that's being created. My opinion is that we don't need more awareness. If 5 out of 6 people in America today die from heart disease or cancer, we're aware. We don't need more awareness. What we need is a solution. And we don't need more drugs to treat the diseases. We need to stop them from happening in the first place. And if they have happened in an individual, work towards finding the root cause of the problem, correcting that, and getting rid of the disease altogether. Because that's the truth. I mean, that's the hope. If you're listening to this, the first part's going to be a little bit doom and gloom. But the good news is that there is hope. And this is what I've done for 15 years. So I can tell you just from my own clinical experience, but I also live in this world of natural health and holistic healthcare. There are thousands of practitioners all around the country who have similar stories and experiences that I do that, they get to see people reverse chronic disease and even diseases that are supposedly uncurable all the time. And it's not because there's some kind of magic It's just by finding and addressing and correcting the root cause of the problem. 1 out of 3 people in America today develop type 2 diabetes. It used to be called adult onset diabetes, but unfortunately, so many adolescents and youth are developing type 2 diabetes now because, a lot of it has to do with our foods that we eat, processed food, big ag, big pharma. There's a lot of contributing factors that we'll get into in a little bit, but it's 1 out of 3. 1 out of 3 people is now diabetic. 65% of our population is overweight or obese. Brain disorders, rapid cognitive decline like Alzheimer's, Parkinson's, dementia, neurodevelopmental disorders in kids, skyrocketing. The latest research that just came out about autism, which is all over the news right now. You've probably seen it. But now they're saying that 1 out of 30 kids is now being diagnosed with some form of autism. And that's exponentially higher than it was even just 10, 15, 20 years ago. And the thing is that a lot of times people want to blame genetics. Our genes haven't changed in 20 years. In fact, our genes, according to genetic researchers, our genes haven't changed for tens, if not hundreds of thousands of years. So why all of a sudden are we seeing this explosion in neurodevelopmental disorders in kids? And not just in kids, but adults too. They survey people around the US every year and they ask people, what's your number one fear as it pertains to health? And it's interesting because it's not being overweight, it's not being crippled, it's not dying of the leading causes of death, which are heart disease or cancer. It's not developing diabetes, it's losing your mind. It's rapid cognitive decline. So it's things like Alzheimer's, Parkinson's, dementia. And I totally get that. We've had several people on both sides of the family, mine and my wife's, Erin's, who've either developed Parkinson's or Alzheimer's. And man, it's tough. I mean, I don't know if there's anything that's more tough to deal with. We've lost loved ones to cancer and had, good family friends who have died of heart attacks or heart disease. And that's bad too. I mean, losing someone you love is never easy, but the reality is, living with and helping manage a person's condition who's losing their mind, whether it's Parkinson's, dementia, Alzheimer's, it's about the most challenging and frustrating thing. And, for the person, obviously, but also for everybody around them that's trying to help the person cope with the issue. Listen to this. I mean, this is fascinating. Life expectancy has decreased for 3 years in a row now. I mean, think about that. Like, we live in the most technologically advanced country on the planet. There's better access to healthcare. There's more medical technology available. And yet life expectancy is on the decline. If anything, we should be seeing people live longer. And it's not just, lifespan, but it's also health span. The average person in America today lives to 80, even though our bodies are designed to last 110 to 120 years, just in terms of the materials and the functionality of our body. That's how we're wired. But even still, the average health span in America is 60, which means that the average person spends the last 20 years of their life, so the last 25% of their life, sick and diseased. And it's not supposed to be, I mean, you're supposed to live at least 100 years before you start to have to deal with these health issues. And we're not even making it, anywhere close. And it's not for lack of trying. The United States consumes over 73% of the world's prescription drugs. So we're doing a lot of things. We're taking a lot of medications. We're doing a lot of treatments. We're trying really, really hard. We spend more on healthcare than the next 9 closest countries in the world combined. So we're spending a lot of money. We're taking a lot of medications. We're going to the doctor a lot. And yet the US ranks almost dead last in every major health outcome category compared to any other industrialized country in the world. So, the reality is everybody wants to be healthy. The truth, though, is that hardly anybody is. And so there's a problem. There's a disconnect. And that's what we're going to talk about today. So why doesn't our current healthcare system work? Well, in my opinion, there's a handful of reasons. Number one is that our current healthcare system is very reactive and not proactive. And, listen, there's a time and a place. If you're gushing blood, if you have a heart attack, if you break your leg, if you have, some kind of major emergency crisis, we actually have the best crisis healthcare system in the world. I mean, you live in the best country on planet Earth if you're going to have a major health crisis, like an emergency crisis. However, we're using a crisis system to promote and engage with healthcare. And it doesn't work like that, right? So we're reactive focused. We're not proactive focused. We're really good at treating disease. We're not good at all in preventing disease. The other reason why is because we're symptom focused. We're not root cause focused. If you go to a medical doctor today, according to the National Institute of Health, you have an 80% chance of walking out with a prescription. And again, there might be a time and a place. Not saying that you never need a prescription, but the question is the prescription correcting the root cause of the problem? And I would argue that it never is. I mean, never. Even in a crisis situation, you might need it, but it's still not correcting the root cause of the problem, because the cause of your headaches is not a lack of ibuprofen in your head. The cause of high blood pressure is not a lack of lisinopril in your heart. The cause of high cholesterol is not a lack of Crestor in your liver. Even when it comes to something that is a crisis, like stage 4 cancer, the reason why you got cancer is not because there was a lack of chemo or radiation or extra body parts that needed to be surgically removed. That's not the cause. And so if that's all we're focused on, we become really good at treating symptoms, but we never actually address the root cause of the problem. And there's two reasons why that approach is bad and why it doesn't work. Is number one, if you're not fixing the cause, then the cause just continues to get worse, right? The second reason is that the treatments that we're using to address these symptoms, they have side effects in and of themselves, and that's exactly why most people never just take one medication. I mean, how many people do you know who started taking a medication at 40 or 50, 20 years later are still just on one medication? There are people who are 70, 80 who are only on one medication, but chances are they just started taking that medication probably pretty recently. It's very rare to meet someone who started taking medication when they were 40, 50, 60, and they're still only on one medication 20 to 30 years later, if they even live that long, right? And the reason why is because the two things. Number one, the original medication didn't solve the original root cause of the problem. And number two, medications have side effects, and so that's why you usually end up taking additional medications to treat the symptoms of the side effect from the original medication. And I think I'm probably preaching to the choir. I think most people understand this. Most people don't want this. I think the bigger question is, well, what do I do about it? Like, how do I not end up like everybody else? And another reason why our current system, in my opinion, just isn't working, why it's broken, and something that definitely needs to be addressed if we want to see change, is the insurance system. The way that health insurance works today is that health insurance will pay for treatments or solutions, quote unquote, for issues that have already manifested, right? Like if you need surgery and you have great insurance, your insurance will cover that surgery. If you have a diagnosed condition and you need a medication, a lot of times that your insurance will cover the cost of that medication, or at least a good portion of it. And that's okay. Like, thank God you have insurance if you're in a crisis again. But insurance doesn't do anything, doesn't pay for anything that has to do with preventing the issue from happening in the first place. In fact, this is a quote directly from Medicare guidelines. And I know this because as a clinician, we accept Medicare patients. And so we're very astute and knowledgeable with what they cover and what they don't cover, unfortunately. But this is a direct quote. It says, a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life. Think about that. When you think about your health, what do you want? You want to prevent disease. You want to promote health. You want to prolong and enhance the quality of your life. They don't cover that. Or a therapy that's performed just to maintain or prevent the deterioration of a chronic disease, meaning anything that you can do just to help yourself not get worse is considered not medically necessary. So what are all those things? Well, that would be things like organic food, clean water, maybe chiropractic or physical therapy, or seeing a naturopath or a functional medicine doctor or a nutritionist. Great things that we could all agree help prevent disease. And yet Medicare, and the reason why I'm picking on Medicare is because they're a government managed agency, pretty much all other major insurance companies take their cue from Medicare. So, whatever Medicare does, pretty much everybody else falls in line and does something either the same or similar. So what I'm not saying is that you shouldn't have Medicare. I'm not saying that you shouldn't have health insurance. What I am saying is that you can never base your healthcare decisions just on what your insurance does or doesn't cover. Because that's like saying, well, if my insurance isn't going to cover my gym membership, I'm not going to work out. If my insurance isn't going to cover organic food, I guess I'll just eat at McDonald's. If my insurance doesn't cover quality sleep and recovery and hydration, I'm not going to do those. It would be ridiculous. But when it comes to healthcare, we've just been fed this lie that you should base all your decisions on your insurance coverage. And people even pick out providers based on who's on their list and who's not on their list. And it's just a giant racket, right? I mean, if insurance saved you, then people with insurance should statistically live longer and have better health outcomes. Well, that's actually not the case. In fact, this won't be a surprise to you, but for the last 20, 25 years, the number one cause of bankruptcy in the US has been medical bills. And a lot of people would just assume, well, those are probably people that couldn't afford healthcare. Like they had an issue and they couldn't afford the bills, so they couldn't get the treatment that they needed. No, over 60% of people that go bankrupt from medical bills have, average to above average healthcare insurance. Why do they still, go bankrupt? Why do they still die early? It's because insurance is great when you need it in a crisis, but insurance doesn't pay for you to actually get healthy. And then like I talked about, there are dangers and side effects to treatments, surgeries, medical intervention, and obviously medications. In fact, according to Johns Hopkins, the third overall leading cause of death in the United States today is something called iatrogenic death. And iatrogenic actually means doctor-induced. So what that doesn't mean is that does not mean that doctors are out there killing people. That's not it at all. I think the vast majority of doctors have great intentions. They want to help people. They really care about people. They want to see people's health improve. So it's not they're not intentionally screwing up or screwing people. What's happening is they work in a system that has all the things wrong with it that we just talked about, right? I mean, there's this standard of care that exists that says, for example, if you're a cardiologist and you see a patient who has high blood pressure, the standard of care is to give them a medication that treats their blood pressure. So even if you're a cardiologist and you believe all the things that we're talking about today, which I would argue is hard not to believe because these aren't really a belief system, they're just truths and facts. But, even if you did want to work with that patient on eating more organic whole foods and exercising more and praying and meditate to reduce cortisol and stress levels and getting better sleep and recovery and hydration and all the things that we talk about on the show. If you're a cardiologist and you recommend those things and you let the patient walk out of the office without a blood pressure medication, you are not practicing according to the standard of care for that discipline, which means you're liable. Like if something happened, like if that patient walks out of your clinic and 2 days later they have a heart attack and the records show that they went to a cardiologist and the cardiologist didn't put them on a blood pressure medication, even if the cardiologist spent 2 hours meeting with the patient, trying to give them coaching on proper nutrition and exercise and stress reduction and all these things, even if they had a record of that, if they didn't follow the standard of care, then now all of a sudden they're liable for a malpractice suit. I mean, this is how backwards the system is and how handcuffed a lot of our healthcare professionals actually are. And this is why you're seeing a mass exodus of traditional healthcare practitioners leaving the traditional model and opening up concierge medical practices, where they're cash only and they don't do insurance and they prescribe very little medication and they can actually give customized care to their patients. It's a big reason why a lot of healthcare providers across many disciplines are moving closer and closer and faster into what we call functional health or functional medicine, which we'll talk about here in just a little bit. And it's because they're trying to get they're trying to take the handcuffs off and they're trying to get out of this system that just isn't built and designed for the health outcomes of its patients. It's really built for treatments, diagnoses, and making money off of people's sickness, right? So again, I know I'm probably preaching to the choir. You probably understand this. And the burning question in your mind probably isn't, is healthcare good or bad? Because I think that question's been asked and answered quite a bit recently. The main question is, well, what do you do about it? So I want to get into, in my opinion and in my experience, how you avoid the system. And even when you do have a major health issue, what you can do about it to minimize your exposure to the system and not get locked into the medical merry-go-round. So step number one is, in my opinion, to ask better questions. It's to ask why, not how. What does that mean? Well, if you have a symptom, the question that you should be asking is, why do I have the symptom? If you have a headache, why do you have a headache? Not how can I treat this symptom? How can I get rid of the headache? That's the wrong question, because if that's the question you're asking, you find answers to the questions you ask. I mean, that's just a life principle, right? So if you want better answers, ask better questions. So the question isn't how can I treat it? how can I treat my high blood pressure? How can I treat my diabetes? How can I treat my overweight or obesity? How do I treat my chronic back pain? That's the wrong question. Now, if you're about to die, then you should probably ask that question, do something so you don't die, but then ask the better question, which is, why is it happening? Why is my blood pressure high? Why is my cholesterol high? Why do I continue to get headaches? Why do I have hormone imbalances or fatigue problems or memory issues all of a sudden or whatever it might be? The better question is to ask why, not how, because it's going to lead you towards the root cause of the problem and lead you away from just symptom management, disease management, treating the effect, not the cause. Second thing is to always start with the foundations of health. Now, listen, we know that there are just certain things that make a human being healthy, right? Just like that there are certain things that make a plant healthy. A plant needs sunshine, water, nutrient-dense soil, no interference, right? Meaning you're not walking on the plants or hitting it with the weed eater on accident every week or whatever it might be. Like they're pretty straightforward. We know that there are basic things that a plant needs in order to be healthy. Well, human beings are not that much different. We're more complex, of course, but there are just foundational things that we know that the human body needs to be healthy. And so the reason why I said you should start with these things is because you can't medicate your way out of a poor lifestyle. You can't trick your system. You can't trick the body or cheat the system to try to, skip steps if you don't have the bases covered. And the bases are really simple. In fact, like I said, I've been doing this for 15 years, tens of thousands of patients now. And a lot of times people are disappointed when I give them the solution to their problem because it just sounds so simple. And the danger is what's simple to do is also simple not to do. And I have found that more and more people actually prefer a really complex solution because they just underestimate the value of the basics, right? And they think to themselves like, surely just more exercise can't can't resolve my blood pressure issue. It's got to be a pharmaceutical or a drug or some kind of complex ablation surgery or procedure that they do. That has to be it can't just be exercise. Like that's too simple. And, maybe part of the problem is I don't want to do that. Like I'd rather take a pill than get off the couch. And I don't think that's most people's mindset, but it could be some. So here are the foundations. Number one is mental health. We know that stress increases cortisol. Cortisol is an inflammatory hormone in the body, and it's good short term. Like it helps you run away from a bear in the woods, or it helps you deal with really high stress situations in the short term. But chronically elevated levels of cortisol can kill you. That's why we know that stress kills. And so if you can focus on improving your mental health, and I'm going to get to how you actually do this here in just a minute, but if you can focus on improving your mental health, it'll make a big difference. And not just because you feel better in your mind, but because of what it does to your physiology. Number two is sleep and recovery. I told you these are basic, but again, what's simple to do is simple not to do. And the vast majority, I would say it's almost 100% of patients that I personally work with, we look at these foundations first, and almost nobody does these to the best of their ability, right? And I'm not saying you have to be perfect, but again, you can't drug yourself out of a bad lifestyle. You can't even supplement yourself out of a bad lifestyle. So a lot of people who are, let's say, holistic minded, they don't want to drug, but they want to supplement because they don't want to go work out, or they don't want to eat clean, or they don't want to get quality sleep, or they don't want to practice mindfulness and work on their stress. It's much easier just to take a supplement stack, even if it's really expensive. That's just people's mindset. So the second one is sleep and recovery. Like you have to sleep. It's like your body's pit stop. Like if your body's a race car, just like in a race, if you've never pit stopped and you never gassed up and rotated the tires and changed the oil and all that jazz, the race car would eventually break down and it'd be on the side of the road. You wouldn't be able to finish the race. Well, your body is very similar. And the good news is that it does it automatically. You have this pit crew that works for you while you sleep, but you have to get enough and you have to get quality sleep in order for the pit to actually work. Next one is hydration. Another super simple one. Most people are severely dehydrated. Most people just flat out don't drink enough water because we think that you should just drink when you're thirsty. And there is an innate physiological trigger that signals to your body or your brain that you should drink water, but you should never get thirsty in the first place. And the way you do that is by hydrating. We're going to talk about how to do that in best practices here in just a minute. Next one is diet. This is probably the most obvious, but the cells that make up your body, the average human body is between 70 and 90 trillion cells. And I think when you think about it, it'll make sense, but your body's only as healthy as your cells are. And your cells literally become the food that you eat, or the food that you eat literally become your cells, right? So if you eat a bunch of pizza, guess what? You're going to have a bunch of pizza-like cells. Not really, but you get the drift, right? If you eat a bunch of life-giving foods, you're going to have life-giving cells. I mean, that's the easiest way to think about it. If you want to feel alive, eat living foods. If you want to feel dead, eat dead food. What's dead food? Domino's, Lay's potato chips, Pepsi, Mountain Dew. I mean, I think it's obvious, but if you just want to feel more alive, eat foods that are alive. Next one is exercise. Guys, our bodies are designed to move. When you don't move your body, it breaks down and it doesn't last as long. It's like a vehicle. Like even if you have a Corvette in the garage, but you never drive it, it's not going to run very well. Why? Because it's designed to be driven, and your body's the exact same way. An object in motion stays in motion. So if you want to move longer, move more often. So like I said, you can't drug your way out of an unhealthy lifestyle. That's why these things are called foundations. And the reality is that your lifestyle always wins. Like you can cheat the system for a while. You can take drugs for a while. You can have surgeries and operations and procedures. You can even, take supplement stacks and do biohack applications that, I'm a fan of a lot of that stuff. But the reality is you can't just eat pizza, not work out, and then lay under a red light bed all day long and expect to be healthy. Like it just doesn't work like that. Why? Because a red light bed is not part of the foundation. Like, should you get enough sunlight every day? Yes. Is there value to using a red light bed? Yes. Does it take the place of or negate the necessity for consistent movement and a clean diet? No, because it's not a foundation. Those things are foundational. So you've got to focus on the foundational things first, then move on to step 2, which is maybe taking it to the next level. And the thing is that, there may be a time and a place when the foundational things aren't enough and you do need to go seek medical attention, and that's okay. But even if you do, you're always going to be better off by focusing on the foundations, because even if you need a procedure or you need a drug short term, you're going to need a lot less of it if you can clean up the foundation. So back to the questions that you ask. If you want better answers, ask better questions. The question should be, ask why, not how. And then number 2 is, where are the cracks in my foundation? And can I get those shored up first, give my body time to do what it was created to do? And then if I need to go seek additional medical intervention or whatever it might be, then you can do that, right? So here I want to give you a blueprint for foundational health. We just talked about the foundations. People's question is going to be, well, how do I actually do that? Like, what does that actually look like? Those are great categories, but tomorrow, if I want to start doing this, what do I actually do? Here's what I think you should actually do. And these are fairly basic. I think they're very achievable and within reach. They're not a heavy lift. Number 1, 7 to 8 hours of quality sleep per night. That does not mean laying in bed on your phone, trying to go to sleep for 8 hours. That means you're actually asleep 7 to 8 hours a night and you're getting quality sleep. So if you're waking up all the time, if you feel like you're not rested in the morning, you're probably not getting quality sleep. But again, that's your body's pit stop so that it can repair and recover from the previous day. If you're not getting quality sleep, you're not in the pit stop long enough, your car is going to end up breaking down. You're going to have problems. Second thing is to pray, meditate, and or journal every single day. And this is an ancient practice. In fact, all these things are ancient, right? Because like I said, what's always created health in a human body is still what creates health in a human body today. But by praying or meditating and journaling every day, you give your brain an outlet to release the stress and the worries of the world. And it's different for everybody. So there's not like a magic formula, but I just think if you're intentional for even just 5 minutes a day, for you, maybe it's in the morning, maybe it's at night, in the evening. For me personally, I like doing it in the morning because I feel like it calibrates my brain. It sets the intention for the day, because we know that what you focus on expands and you attract more of what you're focused on in your life. And so for me, I like to wake up and I like to pray and meditate, and I read something that's uplifting or encouraging. And I've just found that I typically attract more of that into my life during the day if I do that in the morning. But if you can be intentional with that, it'll reduce cortisol levels in your bloodstream, which is your stress hormone, which will reduce inflammation, improve cognitive function, improve executive function. You'll actually get better sleep later on in the day, even if you do it in the morning, just by praying, meditating, and journaling every day. The next one has to do with hydration. This one's very simple. You want to try to consume at least 50% of your body weight in ounces of water every day. So what does that mean? If you weigh 150 pounds, you get 75 ounces of water at least every single day. If you weigh 200 pounds, it's 100 ounces. You can do the math. I would even recommend supplementing your water with electrolytes and trace minerals, just because if you were to take a sample of water from like a mountain spring, that mountain spring water has trace minerals, it has electrolytes, it has a charge from earth that's natural. And your body, the way that God created our bodies, God created your body and he created everything else on planet Earth, almost everything else on planet Earth, to fit symbiotically with your body's physiology, right? That's why organic, whole, raw foods, which we'll talk about next, but that's why if you can eat food as it's found in nature, it's got more nutrient intelligence, not to mention more nutrient density, and it doesn't have all the junk that's in processed foods, but it's got more nutrient intelligence that your body's then able to use and leverage for a healthy metabolism and hormone balance and everything else. What is nutrient intelligence? Well, there's a big difference between getting, let's say, 1,000 milligrams of vitamin C from a vitamin C supplement versus getting 1,000 milligrams of vitamin C from an orange. Why? Is because God didn't create vitamin C supplements, and I'm not against them, I take them, but God didn't create vitamin C supplements. He created oranges, he created grapefruits, he created avocado, and everything else. So the intelligence comes from the whole fruit or the whole vegetable or the whole food that you can find in nature. There are things like fiber and enzymes and phytonutrients or micronutrients that synergistically work together with the nutrient that you're trying to get, which, is in this instance, it's vitamin C, but it's all those other things that work synergistically with that nutrient that creates a lot higher bioavailability. And there are also other benefits to consuming those things as well. So that's my whole foods, recommendation is to eat food by God, not food by man. Does that mean you have to be perfect? No, but if you just prioritized and you were intentional about eating food, like just make sure that the majority of the food that you put in your mouth is in its most natural state or as close to as, maybe you have to cook it. That's fine. I'm not talking about that, right? But like if you go find an apple at the grocery store, it's the same as it looked when it was on the tree. It's just not connected anymore, right? That's a whole food. So I'm not saying you have to go out in the woods and forage everything yourself. What I am saying is that if you can eat food in its most natural state, it's going to have the highest bioavailability, the highest nutrient density, and the highest nutrient intelligence, which interestingly usually leads to eating less of it because there's more of what your body needs. So you have less hunger. Your body desires less volume because it's getting more from what it's consuming. All right, next piece of the blueprint for foundational health, move your body every single day for at least an hour. Does that mean that you have to go for an hour run or an hour bike ride or an hour swim every single day? No, it doesn't, but it does mean that you should get your heart rate up and go move your body, preferably outside, but wherever is fine. Move your body for at least an hour. Why? Because our bodies are designed to move. You're not designed to sit. And I know that I'm sitting right now to record this podcast and it is what it is. It'd be too noisy if I were to do this outside on a walk. But the truth is that our bodies are designed to move. And so the more you move your body, the longer you're going to be able to move your body, which I know sounds obvious, but way too many people are just sedentary. They just sit around, right? Another mistake that a lot of people make is they'll go sit at a job for 8 hours and then they'll go to the gym for 30 minutes. And that's fine. I'm not saying don't do that. That's a lot better than not going to the gym for 30 minutes, but you'd be much better off if you just skipped the gym, but you just got up and moved around every 30 minutes for like 5 minutes, right? And so that's what I would do, and that's another foundational health thing for the blueprint is to never sit more than 30 minutes at a time. Your posture, your permanent posture is a result of the posture that you're in most consistently. So if you sit a lot, you're going to have sitting posture. And this is where text neck comes from, forward head posture, hyperkyphosis or rounding of the shoulders and your upper back. And a lot of this leads to things like neck pain, headaches, lower back pain, even disc issues, even degenerative disc issues. A lot of people think that spinal injuries come from, lifting a piano or getting in a car accident. And those injuries can happen, but they're the vast minority of the problems that I see as a chiropractor. The vast majority of people that I see, it's chronic poor posture. You go sit for 8 hours and then you go home and you do some weeding, or then you go home and you try to pick up your kid or carry groceries in from the store, it's not the groceries that caused the problem. It was the 8 hours of sitting day after day previous to that led you to a state of vulnerability that allowed that injury to happen. So the point is, never sit for more than 30 minutes at a time. And then last one is to lift heavy things at least 3 days a week. Why is this important? Well, again, up until the last 200-300 years, maybe even less than that, the average human was lifting heavy things and carrying things a lot throughout the day. That's just the way that our bodies are primitively designed, And so when you're not doing that, then all of a sudden, when it comes time to lift something heavy, right? Or maybe let's say you're getting older and all of a sudden you have a slip, trip, or a fall and you can't catch yourself because you have no strength to brace yourself during the fall or push yourself up off the ground, well, then you're in a world of trouble. That's a big reason why statistically they say that if you're over the age of 60 and you fall and break your hip, you have a 50% chance of being dead within 2 years. I mean, think about that. Like 60s, it's older, but it's not old. Like most people wouldn't think like, oh, there's a 60-year-old, there's an old person. And yet, just by breaking your hip after 60, you have a 50% increased chance of being dead within 2 years. And it's not because of the hip fracture. It's because of people's lack of fitness coming out of the fracture, and they just can't operate their lives as they want to, right? So those are the blueprints for foundational health. Again, I know those are super simple. And I promise you, like a lot of people just aren't going to do it because it's too simple. They just want something more expensive, more complex, more medical, and whatever. What's simple to do is also simple not to do. And I promise you, if you just look for the cracks in your foundation, you'll see a massive improvement with the way you feel, the way you function. And for a lot of people, because again, I've been doing this for 15 years and it's just amazing. A lot of people are actually able to reverse chronic disease or chronic pain patterns just by fixing the cracks in their foundation. So, okay, I want to talk, last little section here, I want to talk about functional healthcare because I know I spent some time in the beginning beating up the allopathic healthcare system, which is modern medicine. And again, I'm not beating up the people. My mom was an ICU nurse, still is an ICU nurse, for over 40 years. We have lots of great friends in our family who are pharmacists and surgeons and cardiologists and pediatricians. I actually have a lot of great patients even now who work in that field, and they're great people. And the irony is if you actually stop and talk to a lot of these people, they actually see the system as being more broken than the average person because they work in it every single day. And they're even more frustrated than everybody else because they're the ones whose hands are cuffed. So I want to talk about this new and emerging field of healthcare, real healthcare called functional healthcare. And it's quickly becoming the new standard. This is something that our clinic shifted to over a decade ago, way before it was popular. Although I will say in the last couple of years, the functional health side of our business has really taken off. But what is functional healthcare? Well, number one, it's the fastest growing category of practitioners in healthcare today. And it's not just chiropractors, but there are physical therapists, there are naturopaths, acupuncturists, people of every discipline are moving closer and closer to what I would call functional healthcare or even functional medicine because of the distaste for our current healthcare system. And I think it's not just because there's a distaste for our current healthcare. I think it really comes from a desire to actually want to help patients. And so we're seeing what we're currently doing. It's not working. There's this massive desire to actually do something that works. And so there's some core tenets that I think are important to understand when it comes to, functional healthcare and the practice of functional medicine. Number one is that most people that are moving towards a functional healthcare model operate with this, this mindset of testing and not guessing. So there are core foundational things that apply to everybody. However, if we're trying to address a specific issue, healthcare is not a one size fits all. In fact, I think that's another one of the big downsides of our current medical system is that standard of care. It's like, oh, well, everybody that has high blood pressure, they just need this standard of care, this treatment protocol, this medication, this procedure. And that's just not the reality of how disease manifests in the body. Diseases, even chronic pain conditions, more often than not, they're multifactorial, which means there's a bunch of different things that cause the problem, which also means that the solution has to be multifactorial. It can't just be one thing it's not binary. There's not one solution for one problem. It just doesn't work like that most of the time. So test, don't guess, and I'm going to get into some examples of what functional testing actually looks like and why it's different from traditional medical testing, like what you'd get at your, annual checkup or whatever it might be. But another one is that, health and healthcare should not be based on genetics. Now, is there a genetic component? Yes, there is. But if you can really understand someone's genetic makeup, like their heritage, where they're from, what their lifestyle looks like, it can make a huge difference in the course of care for that person versus someone else who might have a different genetic makeup. That being said, I also want to caution people because I think genetics can be a double-edged sword. On one hand, people will say, well, isn't disease genetic? Or isn't it genetic for me because my mom and dad had heart disease. Now I have heart disease, and maybe their mom and dad had a heart disease. So it just runs in my family. So because it's genetic, so to speak, I'm just going to throw up my hands. There's nothing I could do about it. And it's just part of who I am. That's not true. Less than 2% of all diseases are genetic specific, like Down syndrome, trisomy 21. That's an example of a genetic disease. If you have that gene makeup, you have that disease, and there's not a whole lot you can do about it. You can work towards improving function and your quality of life and longevity and all that, but it's pretty much a guarantee. Whereas like heart disease, like all the major things that Americans are worried about today and deal with today, the most common things, heart disease, cancer, diabetes, Alzheimer's, Parkinson's, dementia, these things are not genetic. However, when it comes to treatment and finding a solution that works with your body that's not a cookie cutter solution, it is valuable to understand your genetic makeup because you might have genetic variants that predispose you to that condition, right? So understanding that through functional testing can be very, very valuable. And unfortunately, genetic testing is just not something that's readily available or even offered or talked about in our current healthcare system today. And then lifestyle, everybody's lifestyle is different. So again, this is another reason why I think the functional health approach is so much more valuable and so much more efficient and effective. Efficient means it works quicker. Effective means it actually works. But you have to take into consideration what someone's lifestyle is. So if you take two people, they both have high blood pressure, but this person over here is an athlete, they're vegan, they work out all the time, but maybe they have genetic variants that are predisposing them to that condition versus this person over here who doesn't have the genetic variants, but they sit on the couch all day long. They eat junk food every day. They never work out. They drink and smoke. The solutions for those two people, even though they have the same condition, are going to look radically different. So you have to take into consideration lifestyle. Again, it's not a cookie cutter thing. This is why I'm a big fan of the functional health approach versus the allopathic approach. I've got a great story about this just to make it real. So I had a patient recently named Tori. She was a young girl in her early to mid 20s. And she was young, super fit, very active, actually worked for a company that makes workout equipment and exercise equipment. Well, all of a sudden, in her mid-20s, she started gaining weight. She developed really bad GI issues. She had diarrhea, and then constipation, then diarrhea, and then constipation. So it'd fluctuate back and forth. And then it turned into severe bloating. And it turned into severe bloating every time after she would eat a meal, even after a small meal, like really bad stomach pains, severe bloating, just didn't feel good in her clothes, didn't feel good in her body. She ended up tired all the time, even though she worked out all the time. She thought she was eating clean, and she went to a regular doctor. And again, I'm not disparaging the regular doctor, but this is just kind of the typical course of action. Went to a regular doctor. He told her that there was nothing seriously wrong. There wasn't anything diagnosable, but he gave her some medications for the symptoms. So he gave her Imodium for diarrhea. Then he gave her a stool softener for constipation, which seems contradictory in my opinion, but you treat one, then you treat the other, and you just go back and forth. And then he also recommended Ozempic for the weight gain. And ironically, and again, I'm not saying there's never a time and a place, but ironically, the top side effects of Ozempic or any GLP-1 agonist that's out there today, like Wegovy or Ro, top side effects have to do with GI issues like nausea and diarrhea. And they can even become so severe that they turn into things like gastroparesis or pancreatitis. So gastroparesis is where your stomach literally becomes paralyzed, like nothing gets evacuated out of the stomach, which is also part of the design of the drug, by the way, is to make you feel fuller longer. That's why a lot of people drink a 8-ounce glass of water and they're not hungry for 6 hours if they're on Ozempic, because your stomach just doesn't have any motility. It doesn't pass stuff through in a timely manner the way that it's supposed to. So if you're not eating as much, you're not going to, you're going to lose weight, but you're kind of stealing from Peter to pay Paul. And then pancreatitis is inflammation of the pancreas, which is very dangerous because if you have inflammation of the pancreas, it can interrupt, proper insulin balance, which can really wreak havoc on your blood sugar levels. And that's a whole nother, slew of issues that can manifest from that. So Point is, doctor put her on all these drugs. And, the reason why she came in and saw us is because she was really frustrated. She didn't want to be on the drugs. I mean, she was this healthy person, didn't want to be on these medications, really frustrated. And she was engaged to get married about 6 months, later. So she came and saw us. We ran this test called the GI map test. And there are some really great tests out there. This is one of my favorites. The reason why I like it, though, is it's a functional gut test, and it looks for over 65 biomarkers across a bunch of different categories. So just for example, it looks for pathogens, including bacteria, viruses, parasites. Yes, the average person has parasites that live in their gut. They just don't know it. Also looks for worms like helminths. And this is a lot more common than people realize too. Also tests for the microbiota or the flora in the gut, so like good bacteria versus bad bacteria. It looks for opportunistic bacteria, so bacteria that thrive under certain conditions like inflammation, chronic stress, leaky gut. Also looks for things like fungi and yeast like candida. Like I said, viruses, parasites, and internal health markers like calprotectin, which is a sign of leaky gut, secretory IgA, which is a sign of inflammation, and a whole host of other things. And it looks at, it's all this stuff that traditional medical doctors and our healthcare system doesn't look at. You walk in, you say, I have diarrhea, constipation. There might be a couple of tests or a blood test, but typically you walk out with a medication and the design is to treat your symptom, not the underlying root cause of the problem. So we got the results back, we went over it, and I put her on a plan, and the plan wasn't overly aggressive or complex. It was eat whole foods. It was to eat gut healing foods, which we'll do an episode on at another time. A lot of bone broth, a lot of fiber. And I gave her just a handful of supplements to take. And within 3 months, she was off all her medication. She felt great. She lost 20 pounds. She didn't have to take the Ozempic anymore. And to this day, she has almost no GI issues ever, except if she eats something that she knows she shouldn't eat, which, as a side note, I actually think that's the way the body should work. Like if you can go to Taco Bell and you don't have symptoms afterward, I think you're in trouble. I'm just saying, like, we would actually be a lot more compliant with these foundations of health if our body would show us symptoms more acutely, right? Because I think we'd behave a lot better if that was the way it worked. Unfortunately, our bodies are designed to be pretty resilient, and you can, misbehave for quite a while before you have symptoms. Luckily, in her case, because she had this previous issue, once she healed, her body was very attuned to what was good and what was bad. So anyway, long story short, she felt great, got off all her medications. The eye issues were pretty much gone. 6 months later, she got married. They just had a healthy baby not too long ago. And I get to follow up with her every once in a while. And it's just a testament to the fact that, she needed a very customized approach to her problem. And again, nothing against the medical doctor that she went to, but it was cookie cutter. It was cookie cutter, and it was symptom-based or treatment-based to cover the symptoms, not address the root cause of the problem. And so, the point isn't that traditional healthcare is bad. It's not, but you have to know when to use it, and you have to know when not to use it. It's kind of like if you have a house, like we live on 10 acres out in the woods. And so every year we have to do a lot of fire mitigation, like preemptive fire mitigation. Like we have to limb up the trees. We have to cut the mountain grass. We got to make sure that, things stay wet during the dry months around the house. And the reason why is if we spend just a little bit of time fireproofing our property, in the case that there is a fire, we're going to be in a lot better shape versus just waiting and crossing our fingers and then hoping that the fire department comes and puts out the fire before our house burns down. And when it comes to health, that's what so many people do. So many people just live their life and they seek comfort and they seek convenience, and they just have this false sense of security that if something goes wrong with their health, which inevitably it will, that they can just go to the doctor and the doctor is going to put out the fire. You can do that, but if you do that, you're going to be perpetually putting out the fire. And because you're not ever fireproofing your house, you're going to have more fires to put out in the future. And I think that's what we're experiencing as a country today. And so there's a time and a place. But if you put most of your focus and energy on fireproofing your property, the chances that you'll ever need the fire department in the future are very slim. And if you ever do, you probably need them very little or a lot less than the average person. So I want to recap. So just, remember that our current healthcare system, healthcare, which I think we should just officially change the name, it's sick care. You don't go to a hospital and ask for health, right? Like if you're already fairly healthy, or like if you don't have symptoms and you walk into a hospital or a medical doctor's office and you say, hey, what can you do for me to help me improve my health? They're going to look at you sideways because it's just not what they do. It's like calling the fire department. They're going to say, well, where's the fire? You don't have a fire? We don't do that. You do the fireproofing. So, that system can't be what you rely on and lean on to prevent health and build health from within. You rely on that system if you ever have a crisis in the future, which hopefully you don't, right? Model. Obviously, I'm a big proponent of the functional health model. I think there's a time and a place, but I think if people can focus on those foundations of health, ask better questions to get better answers, ask the why, not the how, focus on patching the cracks of your foundation before you just jump straight into medications or medical intervention, I think you'd be a lot better off. And in my opinion and my experience, because I've done this with thousands of people, if you focus on those things, you have a lot less likelihood of ending up a victim of the system and on the medical merry-go-round. So listen, if today's episode gave you something to think about, I know I give you a bunch, but if it gave you something to think about, the best way that you can support the show is to leave us a quick review, whether you're listening to this on, Apple Podcasts or Spotify or anywhere there's podcasts. It really helps us grow the show, and it helps more people just like you discover how to master their health naturally. And you can just see it. There's this big movement that's happening right now. I mean, that's where the MAHA movement came from. The reason why it's so grassroots and why certain people are getting elected and certain bills are being passed and laws are being passed is because people want this. People want to be healthy because people recognize that health is wealth, that you have a purpose to serve in life, and you can't serve your purpose if you're sick, suffering, or dead. And unfortunately, the system and the model that we have in place that's the go-to currently is just not working. So leave us a review. Love and appreciate you. This is how you become archetype, by taking back control of your health and moving closer to the ideal version of yourself, one step at a time. Thanks for listening. I'll see you next time.